Your Excellencies, colleagues and friends, thank you to the Aspen Institute and the UN Nations Health4Life Fund for giving me this opportunity to speak on this important platform. We are living through the tail end of a pandemic that took too many lives, shattered economies, left many with physical, emotional, and mental challenges whose extent we will only begin to understand over the coming years. The tragedy of which is that a lot of this could have been avoided had we organized our societies differently, had we invested in systems that protect the most vulnerable, had we prioritized prevention. Since decades, the world continues to talk about reforming our global health governance systems, with little action to match the words. Enough is enough. I'm so honored today to join you all for an event that is done with talking. This partnership today between the UN's Health4Life Fund with Aspen Institute is a watershed moment for me. It is the first time that a concrete effort is being made by such a fund to change the way the global health community does business with regards to supporting low-middle-income countries with the NCD and mental health pandemic. Here is to why I believe why this new model will work. For one, it promises to change the dynamic of the partnership. Typically, the global north makes all the decisions with regards to resource allocation, while stripping the global south countries of their right to determine their own path to development. This partnership aims to recognize the importance of having an equal voice. As a former Director General, CEO for the King Hussein Cancer Foundation in Jordan for 15 years, I witnessed this firsthand on how the global donor community decided for us our priorities and agendas. Every year, there would be a new focus by donor agencies. This meant that we would all scurry around to refit our grant requests to fit those much-needed donations, rather than the other way around, needs dictating resource allocation. And I witnessed the duplications and the waste and the disjointedness of donations to various actors, each working on a siloed agenda. As president of the Union for International Cancer Control from 2018 to 2020, I also witnessed this pattern of global donation mechanism repeating itself all over low-middle-income countries. The global north dictating and the global south awaiting deliverance passively. This pattern also included how technical support from well-meaning global NGOs also exacerbated the duplication of support without making a real impact. Having said that, one can have all the money in the world and all the technical support that one needs and still not be able to deliver the enabling environment to fight NCDs. It is crucial for any work on the ground, whether for cancer and NCDs, that there should be the overarching long-term political will that commits to investing in NCDs. Secondly, this needs to be coupled with the right governance and managerial architecture at city level that includes all the stakeholders, including patient, champions, and private sector, all sitting on one table and working on one national plan. Once done, this becomes the reference point for donors and becomes the local engine that will deliver or able to deliver the complex long-term solutions that are required for cancer and other NCDs. This model, which I call the logical business model, was launched by UICC as a City Cancer Challenge initiative and is already making success on the ground. The UN Health4Life Fund is encouraged to support countries who organize in a similar way. In addition, at a time when countries are facing shrinking fiscal space and unprecedented need for health services, governments should also realize that resources don't have to come only from the global north. Financing can come from local sources as well. Funds can be released simply from reducing inefficiencies of local health systems, but more importantly, or more significantly, from investing in prevention of NCDs. By implementing evidence-based measures that include taxing the industries that harm our health, clear labeling and restrictions on advertising of unhealthy products, governments can make people healthier, can reduce NCDs by 30%, can protect women and children, and even be able to put money in their coffers for COVID-19 response, vaccines, and recovery efforts. It is now time for action. The inclusive and participatory systems of global health governance and financing can only be built if we believe in them, if we conceive of them, if we create them, and if we invest in them. Thank you very much.